Hello friends, welcome to Nifty HMS. So in inpatient video part 1, we saw how we can admit the patient from the OPD in Nifty HMS. We also did the operation and planned the surgery as well in the last video. So today this is inpatient video 2, which is a inpatient journey for Nifty HMS. We're going to see how the patient once it is out of critical care, how does the patient journey looks like in Nifty HMS. So let's just check it out. So once you log in, you will see the dashboard. Obviously, we'll look at the patient. So we have the patients in past. So we click on the Adam Smith as a patient. Now this particular patient is out of critical care, and we can move it to a normal bed facility or normal room. So we'll just move him from ICU to a general bed types. We'll assign a new bed to him using the add bed allotment from the patient area. So let's just select that particular patient and then assign him a new bed, non-ICU bed. We can also see the charge, and we can also send the SMS to the patient, whatever changes that can be done to his allocation. So now we have assigned this patient a new bed in general facility. Now we can also add an instrument to him. So he might be recovering from the critical illness or the operation that we have done. So it might be needed a BiPAP or nebulizer or ventilator. So we have the instrument module where we can assign different instrument to this particular patient that helps him in recovery. So we have just assigned a BiPAP, a nebulizer to this particular patient. It automatically adds it to his billing based on the number of days or number of hours that the instrument has been used by him. You can always go to notes and add a doctor note or nurse note. So if the patient needs to be continuously taken care of, the nurse can add their own notes from the nurse note module. If there is a staff that needs to add note, then they can use the staff note. We can always provide a medicine from in-house medical store. So whatever the prescription doctor has written, we can always figure it out from the pharmacy. Go to pharmacy, select a prescription, and you can always dispatch the medicine to this particular patient. The billing happens automatically. The charges will be automatically added to this particular patient. So that's available there. You can click on three-dot menu and you view. It will show you the amount that is pending from the patient side. So that's the medicine dispatch that we have just checked it out. So the in-house pharmacy is really helpful in this case for this particular patient. Doctor notes also you can add over here. So remember the nurse notes, we saw it. Now the doctor is on visit, and they can also add a new note that they certify this particular patient is recovering well, or if there is a dietitian plan, so dietitian can also add diet details over here. So we are here adding a diet plan for this particular patient. So this is again very useful for recovery of the patient, so that we have added in a doctor. Let's just check other modules over here. So we'll go and check the charges and then generate the invoice. So we click on the pending invoice status. So all the charges that has occurred to this particular inpatient, treatment or bed charges, or nursing station charge, or any instrument that we have allocated to this particular patient, those charges appearing over here, and we have not raised any invoice. So that's invoice status is pending. So we now click all the charges, click on generate invoice. So all these charges is now clubbed to a particular invoice. So let's just go to invoice and click on the first invoice, that's the latest one that is at the top. So all the charges we selected in the last step is now coming up here. So ambulance, instrument charges, everything is now clubbed with the total amount that's due. You can always print it, you can also convert it to PDF and collect the payment from the patient. So this is a detailed billing that you can always use. This is your medical billing that can be useful to collect the payment from the patient, and it is always as much details that can be possible. That's all available over here in the invoice. You can also generate the ad hoc invoice by going into invoice, clicking on the plus icon. You can always add a new invoice. You can also add a record income. You can always send a payment reminder if the payment is not done for a generated invoice. You can do so from here on the invoice module just by going to three-dot menu. You can do that. So here all the invoices is available irrespective of the patients, but you can always go and find the patient specific invoice in the patient area. So now just go to the patient again, click on the plus icon, and let's say this particular patient is recovered well and we need to send him home. So we'll order an ambulance for him. Now the ambulance is also available in the hospital, so we'll just request the ambulance. We have just added the charge. We'll just request the time and date, also add the address for the driver of ambulance so they can safely transport this particular patient to their home or the facility that they want to go to. So sometimes it's internal transfer, but you can always order an ambulance. So we just inserted a record successfully for this particular ambulance for this particular patient. Remember, the patient always had the charges for the ambulance that's occurred to them. We can always discharge this particular patient. Now he is good and recovered well. So as a doctor, we can discharge this particular patient. So we can write down the summary, reason for admission in the hospital, what was the problem, what was the diagnosis, and then we does whatever the treatment that we have done. So we'll write the operation that we have done, for example. And the reason for discharge, the patient has treated well or recovered well. We can always write down those details. The doctor's name is appearing, whoever is discharging physician. Medication we can always describe over here. So number of medication, by clicking plus icon you can add as many abbreviations as you need. You can also give the discharge instructions. So we have given a description here as well. In addition to the medicine, we can always write down the discharge instructions over here and save it, and we can also print it, this particular discharge instruction. Thanks for watching the video. There are a lot of things that's not covered in the video. This is just an overview of the IPD flow. So do subscribe to our channel to watch more interesting videos like this. Thank you.